Let's talk about male infertility. India especially, and even many other countries, people believe fertility is a woman's prerogative. In fact, she is blamed for it in case a couple does not have a baby. But let me tell you, in 30% of cases, it's the male who is responsible. In 30% it's female, and in the rest, nothing really is wrong, and yet they don't have a pregnancy. So let's talk about the male part first. Now, a male, as I said, is born with testes, which is a factory where the sperms are produced. Do you know why testes are hanging out in a case of a male, unlike ovaries, which are there inside the body? Because testes require a temperature which is lower. So they require a cooler temperature. Inside the body, we know it's 37 degrees centigrade, but outside they are in a much cooler atmosphere. And here is the point which I would like to point even before I start my dialogue, is that people who work in conditions which are heat related, like smelting and welding, and people who keep their laptop on their laps all the time, these are increasing the temperature of the testes and therefore are hampering the production of sperms. So let me tell you that males otherwise have sperm production from starting from puberty and throughout their life. It is never that they have no sperms, let us say. There is something called an andropause, but it's really not like a menopause. That means 0, no. So let me tell you first of the values which are a little important, because these are WHO values which probably all males should know, is that there's something called a count in a male, which is around 15 million. Yes, there are millions of sperms and it requires just one sperm to fertilize an egg, but 15 million is the count that they take in averagely, which is a good count. So it is just to tell of people who are worrying and have got some of the tests done and they realize that they have, say, not 60 million or 120 million, but if they have anything above 15 million, it's good enough. Similarly, it should be a motile, sperms should be motile and a nice progressive motility and a nice morphology. These are the three facts in a sperm that we see, which calls for looking or not looking into. Now, sperms are produced in the testes, as I said, and then they travel through tracts like an epididymis, which stores the sperm, and through a vas, which travels the sperm, and they are joined by secretions from the seminal vesicles and the prostate, and all of them contribute to the sperm in some or the other manner. In the end, it's a nice head and a nice actively moving long-tailed sperm, which is a good-looking sperm, as we call it. Now, the males can have problem. One, as I said, is in temperature, and which could be only because of extrinsic or varicocele and other conditions which increase the temperature of the testes and which can hamper the production. Then they can have some kind of obstruction, through the long tracts they can get obstructed, whether because of infections or tuberculosis or any other reason. Sometimes in children get operated for hernia, and their vas gets they've tied the vas somewhere, and you realize that the sperms are not coming out in the ejaculate. And it is only for all the males, I would just request, because males usually do not come out to get checked. There is only one simple test of semen analysis, and that clarifies the picture more or less on how we are going to look at the males. So if you have, just get one semen analysis after 2 to 3 days of abstinence, give a sample and ejaculate, preferably in the lab where it's going to get tested, because within an hour it should reach the lab and the person should be looking at it. So if you give a sample in the lab and you look at coagulation and then liquefaction, the sperm should get liquefied and they should have enough sperm, and as I did say, the count, the motility and the morphology is to be seen. Now, in case there is a problem, So in case the problem could be less count, that is oligospermia, it could be a less motile, it could be an asthenospermia, or it could be a not good looking sperm that is not the normal morphology, it's called a teratospermia. So it could be oligoasthetoteratozoospermia as the language goes, and we can correct all. The important is that you just have to find out what is the problem and then you can correct them. However, there are males who have zero sperm and what is called an azoospermia, and that is what is worrisome. If you have no sperms, yet if the factory is producing sperms, we can get the sperms out from there. So you can still have an IVF, TISA baby as we call it, testicular sperm extraction, and yet have your own child even when you have no sperm in the ejaculate. So azoospermia could be obstructive or it could be non-obstructive. So an obstructive azoospermia is easy to diagnose, easy to operate, and easy to have your own baby. In a non-obstructive azoospermia, where there is no obstruction and the factory is not sure, so we still do a TISA. We make sure if we can get a sperm from TISA or PISA or MESA, as we call the micros, you open the testes, you look at microscopically at each tubule, find out if we can still get a sperm, take that sperm out, and then fertilize with the woman's egg through an IVF procedure, and still you get your own biological baby. Important is that you should know that you are important. Males are very, very important. Males have an equal responsibility of giving a good pregnancy, and that any structure that you may have or any problem that you have is treatable. I would just like to say that everything is treatable. You just have to reach the right doctor. Thank you.